This is my continuing coverage of the health care bill, and now we're going to talk about community health insurance option. What is this? Okay. The government has decided to start selling health insurance directly to you. Okay? You know how Blue Cross and Blue Shield tries to sell health insurance to you, and United Healthcare tries to sell health insurance to you, and so on and so forth? Well, now it's the government's turn. So you could buy health insurance from United Healthcare. You could buy health insurance from Blue Cross and Blue Shield. And if you don't want to buy either one of those, you could turn to the U.S. government and buy insurance from them. Isn't that nice? I can kind of see why some of the states don't want this, but nevertheless, you can buy insurance from the federal government. Just thought you should know. Essential health benefits, general rule, except as provided in subparagraph B, a community health insurance option offered under this section shall provide coverage only for the essential health benefits described in section 1302B. States may offer additional benefits. Okay? Let's scroll down. Nothing in this section shall preclude a state from requiring that benefits in addition to the essential health benefits required under subparagraph A be provided to enrollees of a community health insurance option offered in such state. In other words, if the government tries to sell insurance to you, say here in Illinois, then Illinois can say, hey, in addition to the benefits that you're offering now, you have to offer X and Y additional benefits as well if you're going to operate in our state. Okay, so the Secretary of Health and Human Services is not going to buck that. Credits. In general, an individual enrolled in the community health insurance option under this section shall be eligible for credits under 36B of the Internal Revenue Code of 1986 in the same manner as individual who is enrolled in qualified health plan. So in other words, you get tax credits for buying insurance. You get tax credits if you buy insurance through United Healthcare. You get tax credits if you buy insurance from Blue Cross and Blue Shield. You get tax credits if you buy into this community health insurance option. So it's treated no differently than the other insurances. No additional federal costs. A requirement by a state under subparagraph B that benefits in addition to the essential health benefits required under subparagraph A be provided to enrollees of a community health insurance option shall not affect the amount of a premium tax credit provided under subsection whatever. Okay? The state must assume costs. The state shall make payments to or on behalf of an eligible individual to defray the cost of any additional benefits described in subparagraph B. So if Illinois tells you or tells this community health option that they have to have these additional benefits, the state has to cough up the cost of those additional benefits. That way they're not outpriced in the marketplace. So when it comes to buying health insurance, the person trying to buy this health insurance would not have to foot the cost of the additional benefits. The state would have to do that. Ensuring access to all services. Nothing in this action will prohibit an individual enrolled in a community health insurance option from paying out of pocket the full cost of any item or service not included as an essential health benefit or otherwise covered as a benefit by a health plan. Yada, 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 yada. Protecting access to end-of-life care. A community health insurance option under this section shall be prohibited from limiting access to end-of-life care. In other words, if you're trying to treat chemotherapy, you're trying to treat cancer with boy, I'm having a tough time talking tonight. If you're trying to cure a terminal cancer with chemotherapy, the community health insurance option cannot deny you access to those medications. That's a mouthful. Okay, so basically when you're trying to buy health insurance from now on, you can buy health insurance from Blue Cross Blue Shield or United Healthcare or Humana or whoever else you want to go through, or you can go straight to the federal government itself and buy into the community health insurance option. It is regulated by the state, but there you go. Alright, I will tell you more in a future video. Stay tuned.